Good evening, Lagos, and welcome to the Parent Connect Helpline show. My name is Sharon, and it's so good to have you every Saturday, as always, 4 to 5 p.m. You can catch the show. Today on the show, we are discussing menopause in women under 50 or under 40, depending on your situation. Yeah. So if you're 20, you're in your 20s, you're in your 30s, you're in your 40s, this show is for you, and you need to grab a popcorn, grab a chair, and just sit down and take some notes. So today, to help me discuss this very important topic, is a very special friend and a doctor, Dr. Smith, and she's here in the studio. She's a consultant gynecologist and obstetrician right here with me. Good to have you.
Same here, Sharon.
Welcome. So, Dr. Smith, so we're talking about menopause in younger women. Yeah. What are we looking at? What exactly is menopause in younger women? Is there a different name to this?
Okay, so first off, let's start with what is menopause, so that we understand menopause, and then we see why we're concerned about menopause in younger women. So menopause just means that it's a condition whereby the woman stops having a menstrual period. That's just what it means. And the normal age for attaining menopause is between 45 and 55. The average is 51. So
45 and 55.
Yeah, 45 to 55. That's normal. So when it occurs before then it's abnormal. So when it occurs before the age of 45, you call that early menopause. And when it occurs before the age of 40, you call that premature menopause.
All right.
So early and premature menopause are, so when you say menopause in younger women, that's exactly what you are referring to. Yeah.
Okay, how does it come about? And what exactly is it? What does it look like?
Okay, so menopause is a natural thing. Every woman is going to achieve or attain menopause. So I'll try to explain so that everybody understands. The ovaries have number of eggs, and the number of eggs we're born with reduces as we grow older. So we had millions before we were born. At the time of birth, thousands. By the time you're getting to your age of puberty, it's about 400-ish.
Wow.
Okay. So with each menstrual cycle, you have a group of eggs that grow, and then, so it keeps diminishing till you get to the age of menopause.
Wow.
So menopause just means that you have little or no eggs left. The eggs produce two main hormones. We have the estrogen and the progesterone. The estrogen prepares it causes growth of the lining of the womb, and progesterone prepares one for pregnancy. If there's no pregnancy, you have the menstrual bleed, which is your menstruation. So when the eggs have almost completely finished, you have little or no estrogen. So if you have that, there's nothing preparing the womb, and so there's no shedding, and so you now have menopause. But for you to say that one has achieved menopause, it means that for 12 consecutive months, this woman has not had a period. Then you can now say yes.
Okay, so 12 months is the yardstick or the measuring tape. Okay.
So if one has not had a period for 12 months, due to fluctuating or diminishing levels of the hormones, then you can say that yes, this woman has achieved or attained menopause. Now, for younger women, it's not. There are different reasons why a younger woman may attain menopause.
I was going to come to that.
Yes. So some, it's called idiopathic, meaning that it just happens for no reason. You can't find the cause. But in other situations, there are actually causes that can be identified. So some of which are surgeries. So surgery on the ovary, either removal of the ovary or removal of the cyst, may contribute to that.
Okay, removal of the ovary.
Yes, that's what we call oophorectomy. Okay, so if you take out the ovaries, there are no eggs. You don't have those hormones. So ab initio, she will develop menopause.
Okay.
Yeah. At times you have big cysts on the ovaries, which may have destroyed the ovarian tissue such that the amount of follicles left are reduced. So such a woman is at risk of developing premature menopause. Like I said earlier, it's based on the number of eggs. So once the number of eggs begin to decline, then one begins to approach menopause. You have some infections, so mumps may also be responsible. Okay. Smoking may also be responsible. And then you have some autoimmune condition whereby the body produces antibodies that just act or destroy the ovarian tissues.
Oh,
Okay, so in such cases, one can achieve or attain menopause before age 45.
Okay, so if the body, according to you, produces things that can affect that, what is it? An illness you had, or
So it's an autoimmune condition. So there are different conditions that are autoimmune.
okay,
So
please tell us
type
about
1
some of them.
diabetes, some of them.
Okay.
You have some disease of the thyroid that may cause that. So basically, the body just develops antibodies against different tissues. So it's a wide range of disease conditions. Rheumatoid arthritis is an autoimmune condition. So just the same way you can have type 1 diabetes due to that, same way you can have menopause due to that.
Wow.
But I won't say is that common. Mainly it's usually due to surgery, either ovary, oophorectomy or cystectomy, or an hysterectomy. Have an issue whereby you've removed the womb, but there might also be some form of reduced flow to the ovaries, and so one is at risk of developing premature menopause. Yeah.
Okay, interesting. Very good, points you have made. My next question will be, what are some of these effects? Because we, especially in Africa, we can just keep going all over the place, still doing our own thing, and not even know that something is going on with you. Can we have some symptoms or effects of
Okay, so the symptoms of menopause in early women is the same as symptoms of menopause, ab initio. Okay, it's the same thing. The only difference is that menopause from surgery. So I also forgot to mention chemotherapy, radiation. Those are some of also the causes that may cause premature. Yeah, the menopause is due to removal of the ovaries. In such cases, the symptoms are abrupt. Unlike the other ones where it's due to gradual decline in the level of the hormone, so it takes a while. And so menopause really has 3 stages. You have the peri or premenopause, the menopause, and then postmenopause. So most of the symptoms occur before menopause. That's in the perimenopausal state. That's when you have your hot flushes, night sweats, mood changes, depression, anxiety, irritability, urinary symptoms. Most importantly, reduction in sexual desire, libido, vaginal dryness. Yeah, most of them start before menopause.
Okay, do they start all at the same time, or just a few of these ones?
So the truth is that the symptoms lady A may experience may be different from the symptoms another person experiences. Everybody would have one symptom or the other, okay, but the intensity varies from person to person, and the symptoms one would experience. So I can't say, you're going to have 2 out of 10, you're going to have 3, or you're not going to have symptoms at all. Your body will decide which symptoms it would, and then some may start with symptoms, and over time, either they get used to it or it gets better with time. Yeah.
Okay. So the conditions can actually improve.
Yes.
Because someone might be saying, okay, I usually have like one of the symptoms you mentioned, I usually have mood swings.
Yeah.
And then a psychotherapist could attribute that to be that, okay, you're going into some kind of depression or something. So I was wondering if there's a way to separate.
So depression, so you asked about symptoms and the long-term effects. So depression actually is one of the long-term effects of menopause. Others include osteoporosis. It puts them at risk of hypertension, and other cardiovascular diseases. Yeah. Estrogen is actually protective, it's cardioprotective. So when it diminishes.
Did you say estrogen is cardioprotective?
Yes. Okay, so when it declines, you put the woman at risk of developing conditions of the heart. Yeah. Wow. So cardiovascular diseases, dementia, depression, and osteoporosis are the main long-term effects of menopause. Yeah.
Okay. Can you explain to us? You're a medical doctor, and these big words you're mentioning, many of us that are lame people may not really get it. Osteoporosis.
Okay,
what exactly does that mean?
So sorry about that. So it's just the bones. Okay, the bones become very fragile, and then it puts them at risk of fractures.
Okay.
Yeah.
Or fractures.
Yes. So fractures of any, and that's where most women that have attained menopause or after menopause, just a false sleep, and then fracture of the hip, fracture of this, fracture of that. Yes. So it puts them at risk of that. Yeah. And that's why we also say that, okay, once you've attained menopause, vitamin D, calcium, and all that, that's why you see most postmenopausal women taking that. So it's one of the ways of preventing that from happening.
Okay. Now you've gone into prevention.
Yes.
Are there other things women can do? Maybe lifestyle changes or
So the
diet
lifestyle
or
changes actually would depend on the symptoms they exhibit.
Okay.
So for those who are experiencing symptoms of hot flushes, then I would most likely say, okay, so your clothing would change. So you would more wear light clothing. You would stay more in a cool environment, sleep with the AC on, stuff like that. Why? Because basically hot flushes just means this intense heat that you experience. So if you are in a cooler environment, you might experience it less than if you were in an environment that is hot, actually. Then avoiding certain food like spicy food, peppery food, it may worsen your symptoms of hot flushes. Avoiding caffeine, can also play an important role. The primary pathology is low estrogen. Okay, so taking foods that have a bit of estrogen would also go a long way in reducing the symptoms of menopause.
Okay, like what kind of foods? Give us some examples.
So come on, period.
Okay, that was just a joke. Okay.
Yeah, so but basically, so that's part of life. So vegetables, beans, soya beans, fruits, that would help to an extent,
Okay, to
not
help
say
in prevention.
well,
That-
so by it will reduce the symptoms of symptoms of menopause. But the truth is that for premature or early menopause, it's recommended that you replace those hormones till the woman gets to the age of menopause. Why? If menopause is average age 51, and maybe for example she's destined to die at the age of 70, so it means that she's going to have those symptoms for 19 years. Now if menopause was attained at 40, so that's an additional 11 years of having these symptoms. So the recommendation is put them on medication till the age of 51, to reduce one, the symptoms they experience, two, reduce the risk of these complications I've said: depression, thinning of the bones, hypertension, and cardiovascular diseases. Yeah.
Okay. So okay. You've talked about reducing the symptoms. What about is there a way to also slow down the process?
So you know that
Like doesn't come as fast as
no,
it should.
unfortunately, there's no way to do that except one is aware. So like I said, most of the symptoms occur before menopause. So menopause is like the final stage. Once you have attained menopause, it means that ovaries are no longer functioning. You have reduced levels of those hormones already. So you can't prevent it. You can't reduce it. You can't slow it down. Because ab initio, the woman never knew she was going to have menopause. She didn't know until it had
happened.
Yeah.
Okay. Interesting. You're listening to Hot 93.3, the Parent Connect Helpline show with Sharon. My name is Sharon Moggs, and in the studio I've got Dr. Shakirat, Dr. Smith. While you were talking, you mentioned sexually active, or that it affects your sexual drive or something like that. So my question is, does being sexually active too early cause menopause? No, we have this myth.
I will say no. Okay, so it's never say never in medicine, but I do not see how that's so it has nothing to do with the age at which one started having sex.
Okay.
It's not correlated. However, early so let me avoid using medical terminology. The age at which one starts menstruation, if it comes early, that puts them at risk. Like I explained, it has to do with the number of follicles or eggs that are left. So if you started menstruating early, it means that right from then, you have this group of eggs that grow, and every month you have that cohort of eggs that are growing and dying and all that. So if you start menstruating early, you would most likely achieve menopause earlier than you should. But I can't say that would be premature, less than 40, or early less than 45. Like the range is 45 to 55, average is 51. So yeah.
But the flip side, does the lack of been sexually active. I'm trying to bust a few
No.
myths.
No.
Okay, in the
No.
rural parts and in some underdeveloped places, men can accuse their women. Okay, how can you be arriving at this too early? Because probably you were a bad girl in your younger years. So I want you to speak about this.
No.
Okay.
So having sex early, having sex late has nothing to do with menopause. However, so one of the other risk factors is smoking.
Okay.
So smoking may predispose one to having early menopause.
Okay.
And then if there's a family history. Yeah. So yeah.
Okay.
But I don't think there's anything that has to do with sexual activity. Yeah.
Okay. So menopause, according to your definition earlier on, is sort of the reproductive side of the organ of the woman. So I'm thinking that affects pregnancy as well, right?
Yes, definitely.
Okay. To what degree exactly are we talking?
So, if one has achieved menopause, they cannot naturally get pregnant.
Say it again, please.
If one has achieved menopause, they cannot naturally get pregnant. So naturally, why? Because like I tried to explain earlier in the pathophysiology, it has to do with number of eggs. So if you have no eggs, you're not going to ovulate. If you're not ovulating, you cannot naturally get pregnant. But yeah, there are options of fertility for women that have achieved early or premature menopause. Okay. There is IVF. Because the womb is still intact, the womb is not affected. So they can actually carry a pregnancy. Okay. So the pregnancy is conceived outside the womb. Most definitely would not be their egg. Okay. It should be a donor egg. It could be the sperm of their husband.
Okay.
A baby is conceived and then inserted into their womb. So they can actually carry a pregnancy. Yeah.
Okay.
But they cannot naturally conceive.
Okay.
Yeah.
Okay. Any other options?
Yeah, so that's it. Assisted reproductive technique, then surrogacy, depending, then adoption, but that's about it. You can't stimulate an ovary that's technically is dead.
Okay, because I wanted to ask that. Is there another way to? I think I read something somewhere. I wanted to almost ask you: is there another way, like a hormone replacement, something?
So hormone replacement treatment would not get them pregnant. Hormone replacement treatment is a treatment for menopause, for the symptoms of menopause. Okay. So you're just replacing the hormones that are produced by the ovaries. So like I said earlier, you have the ovaries, you have eggs or follicles within the ovaries. These eggs produce two hormones, estrogen and progesterone. So your hormone replacement therapy is just giving estrogen and progesterone or estrogen alone.
Okay.
For you to get pregnant, you need the eggs. So if you don't have the eggs, one can get pregnant. Yeah. So hormone replacement therapy would not help in helping them to conceive. No, it won't.
Okay. Wow. Interesting. So let's talk about now diagnose that. How do you find out? How does the woman find out if she's experiencing the symptoms? She goes to the hospital. What exactly is she expecting to?
So the truth is that most women with early or premature menopause, they don't present early. Okay. And most times it's more of an incidental finding. So they come, I'm trying to get pregnant. Okay. And during your evaluation, when you're asking certain questions, so they say yes to hot flushes, yes to vaginal dryness, yes to certain symptoms that you've asked. And then when you now run some tests, then you now find out that yes, indeed. Yeah. So because menopause is similar to another condition called amenorrhea, which is absence of menstruation. So at times they just feel, okay, my period isn't coming anymore. That's it, it's fine. Okay. But amenorrhea and menopause are two completely different things. The ovaries most likely are still very functional in amenorrhea, but in menopause, yeah.
So if that happens, the woman most likely will be very worried, especially if she's in her younger years.
Yes. So yes, most definitely she will be, because one, she's trying to conceive, she can't get pregnant. Two, she's having these symptoms that she can't, explain, and she's not even aware that such exists. Everyone feels that menopause is just 50 and above, and not less than that. So they may not come to the hospital to complain, and even if they do, they may not come to the right place. So it's a gynecological condition. Okay, even though I said it's natural, but they would maybe go to general physicians. I'm having headaches. I'm having migraines, and people won't even know that these are symptoms of early menopause. You know. So for those who are trying to get pregnant, yes, you can. One may be lucky to diagnose it. However, if a woman isn't trying to get pregnant, so she stays at home, she's not complaining about this, she's just having the symptoms and not complaining until, there's a reason to actually go to the hospital.
Yeah. Okay. Interesting. Is it treatable?
No, unfortunately. So you can't treat. So it depends on the cause.
Okay.
As long as there are no more eggs, you cannot treat it. You can manage the symptoms, and that's where the hormone replacement therapy comes from.
In.
Yes,
If the eggs are not completely exhausted and they're few,
then you will call it menopause.
Okay.
So by the time you are saying menopause, that's it. And that's why they can't get pregnant again. Because that's it. There are no eggs. Unlike men, where their sperms go every 84 days-ish, women, it's the eggs that have been put right from birth. You can't grow new eggs. That's it. So once it's finished, it's finished. Yeah.
Okay. Because I asked that because I know when you were speaking earlier on, you said it diminishes.
Yes.
So I'm wondering, hence we're talking about the ones that are hanging around the early premature menopause. I'm thinking, could they have a few still left?
No.
Or it's completely,
So let me try and explain again.
Yes, please.
So I said menopause has stages. Okay. You have the peri or premenopausal stage. You have the menopausal stage, and then you have the postmenopausal stage. So the premenopausal stage, the eggs are declining, the hormones are declining, but it has not completely declined. It is when they are completely declined that you now have no period for 12 months, then you can now say menopause.
Okay.
So if a woman who is destined to have early menopause comes to see me, she may have some of the symptoms. She may have a diminished ovarian reserve.
Okay.
We may be able to stimulate depending on what the ovarian reserve is. She may be able to get pregnant because she's not yet menopausal.
Okay.
Yeah. So in that stage before, yes, there's a probability she can. It might take time, it might take a while, but eventually she may. But once they have reached menopause, that's it. There's no turning back.
Okay. Can you, at the point, have you ever had cases from your experience? You're a consultant, I'm sure you see things almost on a daily. Have you ever had any experience where somebody who is in her 50s or 60s still has a sexual drive even though she's in her menopause?
Yes. So, I didn't say menopause would completely
dry your libido.
Exactly, So it will, that's why I said reduced.
Okay.
So there's reduction, there's reduced sexual desire, sexual drive is reduced. For some people, maybe absent. Yeah. Okay. So in the 60s, 50s, but I'm sure I've seen a couple of older women, we've done the surgery for them, they're menopausal, and they're asking, okay, so after the surgery, when can I meet? I'm like, I don't understand, meet. They're like, meet my husband. So it just reduces it.
Okay.
I think that I may be wrong, but as women get older, either because of menopause or either because we're dealing with so many other stuffs, we're not as sexually active as earlier. So for younger women, reduced libido will be more worrisome for them. They probably just got married in the first couple of years of their marriage. Their husband wants to have sex with them, and they can't, or they're not really interested yet. So premature early menopause may be a cause of marital disharmony. Because your husband wants it, but you're not in the mood. If you and your husband were probably in your 50s, 60, then your sexual desire may both be reduced. But at that age, he's still really in the mood, and you are not in the mood. So that's one of the issues with premature early menopause. But unfortunately, because this is not, maybe because of the environment we're in, it's not what patients will come to the hospital to complain about. You hardly hear people say, I'm not interested in, well, let me use the word, meeting my husband. I don't enjoy. They don't complain about that. They just assume that it's fine. I'm not in the mood, but let me give him as my husband. Yeah. So they won't complain about it. But I'm hoping that after this show, people or women would realize that, okay, if I'm having this, it could actually be a problem. If I'm having vaginal dryness, I'm not sexually aroused, my desire for intercourse is not there, then yes, it could be an early sign that, okay, there is a problem. And then maybe then they may present earlier to the hospital. It doesn't mean that we can prevent the menopause from happening, but at least we're aware. If they're yet to conceive, we can quickly ensure that they get pregnant before they reach the stage of menopause. Yeah.
Okay, so early detection is key as well.
Early detection of every medical condition is actually key.
Okay, because now you made a very valid point. As it affects marriages and relationships. Because I've heard of somebody who said she could go a whole year without wanting to be intimate with her husband. She doesn't have any of those urges. So there's a likelihood that there's something there. Yeah.
Yes.
So now you talked about hot flashes. Because I'm just wondering, because some people might just say, okay, there might be a way to manage this. People have advised people take medications, okay, take tablets. Like, yes, they even offer them at the counter. So I want to find out, is it wise? Is it okay for people to be doing that?
Okay, so first, I don't know what medication they're being prescribed, so I can't really say anything. I just feel like, when you have certain symptoms, your best person to prescribe a medication to you is your doctor. Hot flushes is the most common symptom of menopause, so almost every woman would have hot flushes. However, what differentiates is the intensity, the duration, and how one can manage. I think I talked about lifestyle modification earlier. So some people are good with that, walk about with light clothing, stay in an AC room. You might feel better. But in cases whereby it's really bad and you can't and it persists, then you might need medications. Okay. Now every drug has its side effects, so it's always a benefits side effect ratio. Okay. And that's why it should be prescribed by your doctor. One of the treatments is the hormone replacement therapy I talked about, but it's not for everybody. There are contraindications to that. Somebody with breast cancer cannot use that. Why? Because most breast cancers are hormone, sensitive. So you're giving hormones, so you're accelerating or making those cancer cells more.
So there are certain things that can act as risk factors.
Yes. Okay. So you don't just give hormone replacement therapy to anybody. Especially if you're going to use it for a long time.
Okay.
So it should be prescribed by your doctor. The two of you will sit down, figure out what are the risks, what are the benefits. If your symptoms are not so terrible, and you look at the side effects of the drugs, then you feel like really there's really no point using these drugs. The diets and stuff. So like I tried to explain, there's some food that may be rich in a bit of estrogen, okay, and since the primary pathology is a decline in estrogen, so taking foods that have estrogen may help to an extent in relieving or reducing the intensity of this symptom. Yeah, but I won't advise just going to a pharmacy to say I want to take this drug, and then because how long do you want to take it for? And then you don't want to treat one condition and then develop another condition. Yeah.
Okay, so Dr. Smith, I think earlier when you were introducing the topic, you mentioned something about drugs, medication, treatment. I want to talk about the drugs aspect. So are people placed, is this for a lifetime?
So that's why I said it's individualized. Some people don't require medications. Some people can cope with the symptoms. Okay, it's not disturbing the quality of their life.
Okay.
But for premature early menopause, because of the long-term risk, the recommendation is there should be an hormone replacement therapy till the age of menopause, which is 51. Okay. Now, if such a patient has breast cancer, or has had breast cancer, or has a family history of breast cancer, I'm not going to prescribe her that medication. Okay. Do you understand? So it's something that one has to discuss with their doctor. What I would tell patient A is most likely going to be different from what I tell patient B, based on that patient's comorbidities.
Okay.
Yeah.
Okay, you're listening to Parent Connect Helpline show. We'll go on a short break. We'll come back. We're wrapping this up with advice for people who have just been told that they have menopause. We'll be right back. Stay tuned. We are back again to the Parent Connect Helpline show on Hot 93.3, Lagos's hottest radio station. And this is the Parent Connect Helpline show right here, 4 to 5 p.m. every Saturday. And today we're talking about menopause in younger women. We're going to talk about managing the after effect of you've gone for treatment or you're on treatment. Can you tell us how we can better manage people who probably are on treatment? You know, sometimes it can be a psychological thing. They might get home and feel, inadequate, or feel like, oh boy, like I may not be like every other woman. Or does it come, the treatment, does it also come with, maybe mood swings or depression, or what exactly should they be looking out for?
Okay, so first thing I want to tell every woman is every woman is going to have menopause. So the fact that you're having yours earlier, I don't really think it should be much of a big deal. Every woman is going to face menopause. And I think the earlier we are able to accept this, then it makes the process better. Okay. If one has, so one of the problems these young people will face is if, for example, they have not had their children. So that's where we would have an issue. However, if they have conceived, they've completed their family size, they are comfortable with that, then what we'll now be focusing on is getting used to the symptoms, the treatment, the drugs, and then the after effects of the treatment and the drugs.
Okay.
So it's more of a psychological stuff. I don't think anybody should feel bad, should feel she's not woman enough, she feels inadequate. I don't think they should, because there are treatments and there are things that one can do. So if it's vaginal dryness, there are lubricants that one can use, I'm not too sure about reduced sexual drive, but I'm sure in this a very busy schedule. Nobody has time to have sex 2, 3, 4 times a week.
All the time.
And if you have an understanding partner, I think it will also go a long way. The mood changes, the mood swings. If people know that, okay, fine, this is the way you are, they may avoid or try not to provoke you, so I think that these are things that can be managed. Premature menopause is not like somebody dealing with cancer, so those ones
somebody could actually feel, because I heard one, she was in her 20s, she actually almost committed suicide,
so that's
I can't
where,
give birth. That was her fear.
Okay, so that's where multidisciplinary care comes in. You need a psychologist for somebody like that. You need a good support system, you need good family members. It's just we're seeing a lot of women in their 50s, 55, 60s going for IVF and having their children, So menopause doesn't mean you can't carry a pregnancy.
Not a death sentence.
Yes, it's not, and I think I want every woman to understand that, and it will go a long way, in relieving some of these things that we just put up in our head.
Yes.
Yeah. So treatment is the hormone replacement therapy, okay? And as long as there's no contraindication to it, women will be on it. The good thing is that symptoms over time, it might decline, it might stop, and your body will get used to it, so it's not really a big deal. Follow up with your doctors is important. Why? Because of the long-term complications I talked about. So hypertension, cardiovascular disease, as well as thinning of the bones, making one at risk of developing fractures. So if you frequent your doctors, we can prevent that from happening. So I don't really think there's really much, For me, information is key. If you're not aware that such a condition exists, then when you're having all the symptoms, you get confused as, I don't understand what's wrong with my body.
Exactly.
That's one. Two, the fact that you should know that you're not alone. You have a lot of people, women, dealing with premature early menopause. So the fact that you're not alone should give you some form of, relief and
comfort.
Yes, it's something that's going to happen either way. So yours is just starting early. You can modify some of the symptoms, and then there is the treatment.
Fantastic. Your final thoughts, Dr. Smith.
Well, so final thoughts. Every woman should know their body. Every woman should listen to their body, because menopause doesn't just happen, except, if the ovaries were removed. But most times there's a phase before menopause, and most times most women ignore the signs until eventually it happens. Like I said earlier, it's not like we can prevent menopause from happening, having an issue, but one, you're already aware that this is happening, so that when it suddenly happens, it doesn't take you unaware. Okay, you're not traumatized or feel sad or inadequate. I don't think that's an issue. So, premature early menopause, yes, for women who are yet to conceive, yes, it may be worrisome, but there's always assisted reproductive techniques. Maybe more expensive, but a lot of places are doing that now. Government hospitals are doing it at a cheaper rates, so there's always that hope. The economy is not smiling, so I don't think most people want to have more than two. So you do your IVF, you have 2 children, and then you're good. So if anybody is experiencing early premature menopause, I think I'd just like to say that I understand, and I feel that you shouldn't let it weigh you down. You can always talk to your gynecologist. We can always figure out a plan for you to help you be comfortable with whatever symptoms that you are experiencing. Yeah. I think that's just what I want to say.
Fantastic. Thank you so much, Dr. Smith-Okono, for being in the studio with me. Thank you. I appreciate your coming. This has been the Parent Connect Helpline show.